came on, but I get the mute button.
Push the program on the mixer. I did. It is programmed. The program.
Get that. Could you try again?
Shut up, Alexis.
Yeah, I got it's the mute button here. I can't get it to go off of mute.
Oh, now mine's gone. Alright.
There you go.
There, now it is.
Push the program.
I can hear Karen talking on here.
The program.
Get that. Could you try again?
Shut up, Alexis.
You gotta like push it and hold it until the Wi-Fi thing goes away, and then and once that goes away, you can.
Put it on the far right side.
It took like a minute for mine,
There you go.
and once it went away, I could push
Hello.
it again, and it went.
Far right. What did you do? There, now you're
It's
on.
like you're gonna burst into song.
Oh, yeah, all right. You don't,
Try letting go, see if it does anything.
I'm a finch
go.
that does
Now
not
you're on.
sing well.
There you go. There you go.
Okay,
I tweet really bad.
check.
Hello? We'll just leave it on.
Yep.
That's bizarre.
Watch what you say.
Oh, now it works. There you go.
6 o'clock?
Oh, I see we figured out how to have more than 3 on at a time.
8's the limit.
8?
8.
Cool.
Ninth person goes home.
No need to be here.
Turn it off. These people bothering me during a meeting.
All right, I got 6 o'clock. Everybody ready?
Yep.
All right, I'd like to call the village board meeting to order. Everybody please rise for the pledge of allegiance and a moment of silence.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Roll call and open meeting law compliance check.
President Jeff Millies.
Here.
Trustee Jay Pecca.
Here.
Trustee Gary Finch.
Here.
Trustee Dylan Newman.
Here.
Trustee Jim Hirth.
Here.
Note for record, Mr. President, you do have a quorum of your village board. Note for record also, our illustrious building inspector, Vince Budiak, is here also, and you're in full compliance with the open meetings law.
All right, we got the ceremonial swearing in of the village trustees, 1 and 3.
So gentlemen, do you want to do this individually, or would you like to stand together with your right hand raised?
We can do it together if you want. It doesn't
Up
make
to
any
you. I
difference to
can do
me.
it.
So,
I'm reading off the cheat sheet.
so
You'd have to
you will raise your right hand. I state your name,
I, Dylan Newman,
I, Jay Pecca,
and then you read this together. Who've been elected on Tuesday, April 7th, 2026.
who have been elected Tuesday, April 7th, 2026, to the office of village trustee
Number 1.
3.
The Village of Vernon swear that I will support the Constitution of the United States, the Constitution of the State of Wisconsin, and will faithfully and impartially discharge said duties to the best of my ability, so help me God. And you
Of
say,
the village
I
of
will.
Vernon. I would just say I will.
Yes.
I will.
Congratulations,
I will.
Supervisor Peck and Supervisor Newman. Mr. President, it's up to you.
All right, we have a proclamation to read here. Whereas the office of municipal clerk, a time-honored and vital part of local government, exists throughout the world. And whereas the office of municipal treasurer is a time-honored and vital part of local government that impacts the day-to-day life of individuals throughout the state. And whereas the office of the professional municipal clerk provides a professional link between the citizens, the local governing bodies, and the agencies of government at other levels. And whereas municipal treasurer provides the necessary final information to government bodies and agenda at the local, county, state level. And whereas professional municipal clerk have pledged to be ever mindful of their neutrality and impartiality, rendering equal service to all. Whereas municipal treasurer are the official custodians responsible for the proper management and investment of public funds. And whereas municipal clerks and municipal treasurers continually strive to improve the administration of the responsibilities through participation in education programs, seminars, workshops, and the annual meeting of their state, county and international professional organizations. Whereas it is the most appropriate that we recognize the accomplishments of the official, of the Office of the Municipality Clerk Treasurer. Now therefore, I, Jeff Millies, Village President of the Village of Vernon, hereby recognize the week of April 20th to 26th, 2026 as Municipal Treasurers Appreciation Week, and May 4th through 10th, 2026 as Professional Municipal Clerks Week, and further extend appreciation to our professional clerks and treasurers, which include Terry Winarski, Sue Fisher, Lynn Barticle, Kelly Colner, Tammy Spoon, and Karen Shu for their vital services they perform and their exemplary dedication. Dated this day, April 16th, 2026. Thank you, everybody.
Yeah, I was gonna say, yeah.
All right, public comments.
The closed session, Mr. President?
Oh, yeah, I was doing all that reading, I passed that. Possible closed session, consideration and possible action on a motion to convene into executive session under Wisconsin State Statute 19.85, parentheses 1, sub parentheses G, for the purpose of conferring with legal counsel for the governmental body who is rendering oral or written advice concerning strategy to be adopted by the body with respect to litigation in which it may or may be involved, specifically concerning code enforcement proceedings involving Greenmeyer property located at South 87 West 23375 Edgewood Avenue. Included in closed session will be the village board, village building inspector, village attorney by phone, and village administrator clerk. This will require a roll call vote and no decision will be made in closed session. Now on to public comments. Any public comments? Since not many public here. Miscellaneous matters, advanced life support agreement with Village of Waukesha, Village of Big Bend, Genesee Wales, East Troy area, and Tichicon Fire Department. Was the chief coming for this?
I don't know. Do you want me to call? I'll call him. I think we put all the agreements on the agenda just in case board members wanted to talk about any of the other agreements, but I tried to look at the Village of Waukesha's meeting from February to see what the discussion was, because no one from the village contacted us at all. And the motion that you made at the meeting to approve it was that it was identical, which it was not identical to the, and in fact, in their minutes,
It started out identical, and about halfway through it went off the rails, yeah.
and in the minutes, it says right in the minutes, they change. And usually, when municipalities do that, they meet together to talk about it. You don't have one, we don't know why they changed 13 and 14, there's no,
But either case, it needs to be changed along with the rest of them.
Sure.
Correct.
The Big Bend and Village of Waukesha, I think are the only two where we get the advanced life support intercept fee. The rest of them, or the old agreement we have in Waukesha, where it just talks about reimbursement for supplies used.
Yeah. I know I asked McGuanago what their fee was. It was like $557, $552, somewhere in there. So I think that we should just look at maybe changing some of the wording in there and then send it back at this point.
Well, we need to change the fee amount for sure.
Yep.
Also, I wanna make sure if we're going on a call, we're getting paid for it.
Correct.
That's one thing I
That's,
wanted to
I mean,
stress.
if we transport, we should be getting paid through the insurance company for that.
The trip
But-
charge, right?
Yeah, but are we getting that or are we showing up there and then that community ends up transporting and we
Right.
missed up? So we need a little bit more clarification on that because we're not showing up and not getting paid.
I think what I said last meeting was I would like to see it if we leave the station, we at least get that money. You know, I know there's standards and fine lines and stuff, but, you know, it's getting to the point where I think we need to start changing some things around and.
So, those are my two things that I wanted to see changed in the agreement.
The language.
I could see if we leave the station and arrive on scene, we gotta get paid something. If we're halfway there and turn around, I can say, okay, then you'll get paid something like that. But if we're on the scene, we're getting we should be getting some type of reimbursement.
Is that too much? Is that, can you do that? You know?
Yeah,
It's
I don't-
like, if you call us, we should get paid. You know,
Well,
then
a lot
maybe
of-
they'll think more.
Well, a lot of times, it's dispatch
I was
is,
gonna say, I don't
is
think it's the
making
municipality,
making a
it's
call, they don't
dispatch
really
doing
know
it.
what's going
That's
on.
okay. I mean, we still get paid. It can still be put in the language. You know, it doesn't matter if dispatch does it or the Village of Waukesha or Big Bend, it's,
you know, they put the call in right away and not realizing, oh, it's not that severe. You know, or,
Well, the other option that they have is they could just not sign our agreement and we'd still be providing mutual aid. Like, we don't wanna
Well, that's
create
a-
an agreement they won't sign.
that's another thing that we need to talk about, because when you're spending 50% of your calls for mutual aid, so we had 100 calls last month, 48 of them were mutual aid, that's absolutely unacceptable. We should not be in another community 48 times.
I wanted to know
So we need to,
why last month was so high compared, that was a higher total for a month than the whole year so far.
yeah, and then you notice the intercepts came down by half. So I don't know, I'm kinda curious to know what happened,
That's
or,
why I thought the chief was gonna be here. Oh, okay.
Another thing is, can we put an escalator in there, follows the, inflation rate?
Okay.
So
Why
every
don't
year
we-
it goes up 3%.
it is 3% McGuanago.
Why don't we put
Goes
this
up
on
to
hold
50,
right now
okay.
until the chief gets here?
Okay,
Then we'll circle back to it with,
Sure,
cause he's
that
gonna,
sounds good, yeah.
we'll need his input, we'll keep moving. So let's do the appointments. Reappointment of Tom Tomasak to the Vernon Fire Commission, term ending on 4/30/2031.
Mr. President, Tom Tomasek said that since he's turning 50, he's getting a little older, and he said that he would fill in until you find a replacement, but he would like to concentrate on finance for the village and serve the village in the financial capacity. I'm aware of two other people that would like to serve, but I don't know if the board would like to put something in the next newsletter to give everyone an opportunity to apply to be on the fire commission, or what would the board's pleasure be?
Well, you have two people you know that are interested?
Yeah, two of them that served on the fire commission previously.
I'm fine with just contacting those two and see if one of them wants to do it, or,
Well, they would submit, they
I-
both said they'd be willing to submit a resume to the board for you,
Good,
for your
okay.
consideration. Should I do that?
Sure.
That's
let's do
fine.
that.
Okay. And Tom said he would serve until you get a replacement, but
Why don't we put it out to the public too, so we get, see
Well-
what we get?
okay, yeah, we can, but it's usually, nobody applies.
I know, but
It's usually you gotta know somebody to twist their arm to get them to serve.
we could put it on Facebook and the website that you'd like to have all submittals in by, because you have a longer time to wait at the end of the month, if they'd have it by, April, whatever, because you don't have a board meeting till the
Yeah, cause the
7th.
newsletter's gonna go out for a while.
Yeah. Is that agreeable? Should we just do it that way, gentlemen?
That's fine. Do we
That's
need to
fine.
appoint him to a temporary term?
I think we have to reappoint him, don't we, for a while?
Well, his term ends up on the 30th of April, and I don't know if you wouldn't have anybody in
okay.
place. And they can function with 4 members. You have 4 members that've been on the fire commission for a long, long time, so.
No. All right.
So we'll table that one. Up, and the chief's here.
Okay, let's get these appointments done
You
then.
wanna come up here?
Reappointment of Dylan Newman to the Plan Commission, term ending 4/30/2028.
This would be for a 2-year term?
Still willing?
I don't know about that guy.
I know. We have nobody else.
If you need a motion,
Yes,
I'll
I'm
make
still
that
willing.
motion.
I'll make a motion to reappoint Dylan for the term of Plan Commission ending in 2028. So
I'll second that one.
All in favor of the motion?
Aye.
I'll abstain.
Opposed with one abstention, motion passes. Reappointment of Dan Nowak to the Board of Appeals, term ending 4/30/2028. Stan willing?
Yes, I did talk to Mr. Nowak, and he'd be perfectly happy serving. He's got a lot of experience being a former building inspector and on the Plan Commission and Board of Appeals for many, many years.
I'll make a motion to reappoint Dan Nowak to the Board of Appeals.
Second.
All in favor of the motion?
Aye.
Opposed, motion passed unanimously. Appointment of the village trustee to Vernon's liaison to the North Prairie Joint Municipal Court.
We always have one trustee that serves, each municipality has an elected official that serves on the committee. Dylan's done it for a number of years, but he's willing to step away to have another trustee take that position.
Any volunteers?
I can take it.
So then you would make a motion to,
I'll make a motion to appoint trustee Hurth
I'll
as our
second that one.
new liaison with North Prairie Joint Municipal Court. Any discussion? Hearing none, all in favor of the motion?
Aye.
Opposed, motion passes unanimously.
and the cheese here.
And we'll circle back to the advanced life support agreement with the communities who were listed previously. We had some questions, we were trying to do a new contract. Change the rate, it's one thing, at least Match McClanago's, we're all in agreement on. We also would like to see, to know that we're getting paid. If we respond to a call, we don't wanna see you guys getting there and then all of a sudden, the community shows up and takes over and you're not doing the transport. So is there some type of wording we can put in where if we're called, we do the transport?
Well, that's in there. If we transport, we get it.
Well,
No.
I don't know if you can really, that's an operational, thing that's very dynamic, that whatever reason we determine who transports, it's gonna be based on what's in the best interest of patient care, not charging someone for a fee. I think that we've done a good job of working with, essentially the village of, Waukesha about, if it's a more critical call, we've opted to take them in our vehicle. If they don't show up, we obviously transport and get the trip charge. If we go with them, it's an intercept fee, so it's one of those things that typically, we'll do what's in the best interest of the patient. I mean, we do try to, if that possible, we think it's gonna be in the best interest of our paramedics operating the back of our ambulance will transport that way.
well, the patients should be honored that we're fighting over them, who's transporting.
Well, and that,
Jeez.
it's kind of ironic that you kind of mention that, because there are other systems where that becomes very problematic, to where
Yeah.
people start arguing in front of patients, and that's very unprofessional, and, well, we should take it, well, why, no. Let's do it in the best interest of the patient for patient care, and we'll go from there. So we always try to err on the side of what's best for the customer.
So, out of the 7 last month, how many could you tell me how many we got paid for? Or how many were
Which 7 are we referring to?
intercepts, right? 7 intercepts last month, or March?
I'd have to, is that what the report said, 7 of them?
I think
Yeah.
it was 7, yeah.
So we'd get paid the $450 intercept fee in those,
We should, yeah.
yeah.
Okay. So how many,
But you did not technically approve that intercept agreement.
Yeah, we did.
You did, okay.
no, we didn't. We have in place right now is that whatever Medicare or whatever insurance doesn't cover, Waukesha has to pick up the remainder of the bill. Going forward, we're keeping track of that. That's what the old contract stated. It was worded weirdly, yeah. It wasn't the same as the rest of them.
We were supposed to have matching fees, so that when we transport, it'd be the same fee as
Yeah.
Waukesha. I don't know what their fee schedule is, though.
But you guys sent correspondence out saying that the intercept agreement, because there was some questions on the language, the new one was not technically in effect.
No, so
That has to be clarified and has to be reapproved, because right now we don't have the authority,
yeah, we have the old one.
Yeah, we have the old one in place.
but the old one did not address a fee or an actual amount.
No, that just
It
says
says they'll-
supplies.
if we transport, we get the money.
Right, oh, absolutely.
And then whatever
But
that,
the intercept fees per se.
whatever they don't pay the patient, the village has, I think, 60 or 90 days to
Right.
pay that. So we're starting to keep track. So we should be seeing money essentially, now, as long as somebody's tracking that. But the fee, yeah, we have to change the contract.
Well, if we do an intercept, we're not getting paid then.
If we do it right now, correct, with them, because we don't have that stated in that contract. It had to do with the trip charge, the transport fee. That's what the old contract said for Waukesha. But
Trying to think.
I would like to see, yeah, if we,
I'd like to see a late fee. Cause I don't see a late fee in here. So what's stopping them from just not paying it on time?
it's a municipality, I think.
I think first things first is you have to make sure that you have the proper process in place. You have, the fees are correctly established, and then you have to have the calls occur so that you can process those intercept fees. But you made it very clear when we had a meeting probably about a month ago that if the intercept agreement that we proposed with the Village of Waukesha, that if it wasn't verbatim with the Village of Big Bend, that you weren't going to approve it. And that's how your motion was made. There was some correspondence that went back and forth between the board members about the fact that those did not line up as you thought they would. Because I think there was some verbiage about letting a paramedic operate with the service. The amounts were the same, but according to your motion, those intercept fees were not approved because you guys didn't agree on it. So until that happens, we really can't bill them for the intercept fees because your motion did not pass.
We're not saying.
I'm not saying
we're
that,
not
I'm saying we
that.
should, to add to the agreement we're trying to approve.
So you need to clarify exactly what you want, because that previous agreement was very vague in what it said and didn't really address the intercept that occurred. So I just want to make sure we're on the same page.
We're basically trying to come up with a new agreement,
I totally
add
agree.
language, add different numbers, and then send it off to Waukesha. From my understanding, right, is that what we're,
Right.
so that's what we're talking about is,
But between what happened and when that occurs, we technically cannot charge them for an intercept.
but we still get, we're not,
That transport's different than intercept though.
Yes. Yeah. Totally different.
yeah,
That's what he's talking
if we
about.
get, but I'm
We're not getting
saying,
anything. That's what
Right.
I'm saying, is we're not getting a dime from
Yeah.
Waukesha. Unless unless Chief knows who's paying what for that.
well, I thought we established that last time, that we're gonna start tracking this now. Right?
Yeah,
Okay. Because we should be tracking the patients, the transports, whatever, for the Village of Waukesha,
I don't know,
until this new agreement is passed.
and I don't know how you do that.
I mean, we're falling back on the old agreement, which wasn't working.
Right.
That's because nobody was keeping track of it.
Yeah, but how
Why
would you?
wasn't anybody
How
keeping
would you,
track?
how would you know, how would I know on, looking on a bill, what was a call to the Village of Waukesha? You know, was it their resident there, or was it on the freeway and a Waukesha resident? Was it a Waukesha person visiting the Village of Vernon? I mean, what are I don't know the circumstances of the call.
Well, they do.
Yeah, the fire department would,
Yeah.
but we don't.
I mean, why, I mean, I can go back and watch the last meeting, but we specifically talked about going forward, we were gonna track the money that should be coming to the village with this old contract until we, pass a new one. Because they know if they transport, where it is, for what municipality, right?
Well, if we transport, we create the trip charge. If
Right.
we don't transport, we don't create a trip charge.
Okay, but if we transport in the Village of Waukesha, that's documented.
Yes.
Okay. We bill the patient's insurance company, right? Okay, you know that, you see that, right? Okay,
That's not what you're talking about. You
That's-
said 7 intercepts. Intercepts are totally different than a trip charge.
but in their contract, in the ALS contract, is what the contract, the ALS contract is what I'm talking about. So we haven't seen any money even from that. So,
The village clerk said they've never paid any, their
Correct.
municipality has.
because they never got a bill, so we've never billed them for the,
Because the patient receives the bill for the transport.
yes, and if they don't pay, or they only pay, they have to pay within a certain amount of days, 60, 90, whatever it says in that contract, I'm pretty sure it's 60 days. Okay, and if the patient doesn't pay that within 60 days, then the Village of Vernon sends a bill to the Village of Waukesha, the Village of Waukesha cuts a check to the Village of Vernon for the excess amount. That's how that contract's worded. So, from my understanding from the last meeting, going forward, we were gonna keep track of all this so that we could start billing the Village of Waukesha to get paid.
Well, I think it's problematic from a couple different points, is that the standard billing procedure that happens is not done in 30 days, because most insurance companies don't actually process their claims in a timely manner.
It could say 90.
Secondly, if we bill the patient for a trip that we do or we transport in our ambulance, that runs through its whole process that our billing company follows. The Village of Waukesha will have no idea, nor will we, until probably, it could be up to 180 days out if what happens, and then that's not even considering the Medicare write-offs or mandates that the federal government provides to us. You cannot make someone pay in a difference of something if it's a Medicare.
So then when that contract went to legal review and they approved it, how did that happen?
I guess that'd be a question for our attorney, because I don't know.
Yeah, because it's the same contract with the other communities. That's the old one. They're all the same, except for Big Bend.
They're all 450, right?
No, there's no 450. Big Bend's the only 450.
No, they're all
They're all
Are they?
they're all 450s.
450.
with
The old ones,
exception of-
the old ones.
The difference between the Village of Waukesha and the other intermunicipal agreements we had for intercepts was that, there was a shared services concept that was kind of built into that many years ago. And because of the way things have changed, that's when we went back and revisited that. That was done by, I forget which board did it, but that contract was reviewed by Macy, and that's how you guys took care of it. I don't know exactly what the ins and outs of it were, but we, moving forward, wanted to focus on the majority of what we do there is the intercepts were where we were kind of losing the revenue.
Right.
Was we wanted to institute, going back, I think 2 or 3 meetings ago, we wanted to institute the intercept fee so that we could start to recoup those costs, and then come back with some evaluation and looking at our whole process and figure out what is the correct number to charge for intercepts. And then, obviously, if we do any trip charges, those are that's totally, that's billing the patient itself. And that's outside of what the intercepts were trying to accomplish. So, we want to get the intercept thing solidified with them, because that's where most of our business comes from, is the intercept fees. We do, and we have in the last month or so, taken some people in our ambulance with a trip charge. And that's something we probably could go back to the billing company and figure out how many it is and how it goes. But that, I don't know if the legality of being able to apply that to the Village of Waukesha versus the person, because they have the insurance and the financial responsibility.
Right, I should have been more specific. I meant just the ALS agreement in general. So that kind of includes your intercept and the trip charge, according to the contract with Waukesha, the current. So that's why I was,
That current contract had no numbers in it, though,
no, but
which was problematic.
well, not necessarily, because it just states that, if we bill the patient at $2,500, they're insured, they pay $500 with, I don't know, I can't really see this because it's really patchy, but 90 days, they have 90 days to pay. And if they don't pay within that 90 days, or they paid $500, then the Village of Waukesha is responsible for $2,000, and they have to write a check, and then Village can collect from them or put it on their
I
tax
think
bill.
you're reading that all wrong.
I don't think that's how it works.
It's not, yeah. Because,
That's what that's what it
no,
said.
because on an intercept agreement, that's where they respond in the Tahoe or whatever the truck, and they assist in.
Trip charge, I'm talking about.
Okay, but we're getting money, we're losing the money on the intercept. We have no intercept fee right now.
We're losing the money on all of it.
No, not if we transport, we get paid by supposed to be getting paid by the patient we transport.
Yeah, but if they don't pay, then it was,
Well,
then
we
what
have
I'm
that
saying
problem
is
with every community and even
the-
Vernon resident. If
the
they don't
agreement
pay-
with Waukesha was different than the other municipalities. We read it that meeting, we read the whole agreement. And I thought we were all under this, understood what it said. You can barely, here's maybe a better. I'm gonna read this again, and then I'll get back to you, because
Look at B, 5B.
5B.
To ensure payment for each payment when the Vernon Fire Department paramedics respond, accompanying patient to the hospital via the Vernon or Village of Waukesha Fire Department ambulance. The Vernon Fire Department, through its billing services, agrees that it will invoice each patient at the Village of Waukesha's rates that are in effect the date of the treatment. In the event such invoices remain unpaid in whole or in part after 180 days, the balance due on such invoice may undertake any steps the Village of Waukesha deems necessary to collect the outstanding balance due to the patient.
So that would mean like sending them to collections or putting it on their tax bill or something like
For them
that
to
to
get
collect
money,
it.
but we should be,
We get, no, not us. They pay us, and then they
Yeah.
put it
yeah,
collections.
however they get their money back, that's their business.
See, now you kind of understand where I was going with it. So we're still missing money. We still should, from, when was our last meeting? When we had that one. We should be keeping track of these patients that we transport out of the Village of Waukesha.
We are.
We are.
And we
get paid for those.
We get paid for those through our billing procedure.
yes, and anything unpaid within 180 days gets charged to Waukesha.
That's 6 months.
Yep. Which
We had a meeting a month ago.
we've had this, but we're keeping track, right? Is what I'm getting at?
We are following our billing procedure and our policies that we've contracted through.
You need to follow the agreement that we made with the Village of Waukesha. Because it's been 4 years.
And when we transport a patient pays, and we gotta get the numbers from our billing service saying we didn't collect.
That's you.
I mean-
I tried to get back. I asked if we could go back 4 years. We couldn't.
We had two different billing services, but Chief, does the billing company, do they know when it's an ALS or not an ALS, a trip charge to the Village of Waukesha?
Yes, our document, our
I can call tomorrow.
EPC, our
Okay.
electronic patient care report will outline what type of trip it is, whether it's an intercept or if it's a transport, whether it's a resident or a non-resident, and they follow the procedures that are established through the billing process and also through the mandates with the federal, Medicare and all the other challenges that they have. And we now have the same billing company as well, so hopefully we can create a more streamlined process that if we do have the interagency charges, that we can track those effectively instead of trying to, piece together between one outside agency and our inside agency,
So, on those 40-some mutual aid that we gave this month of March, did those result in us transporting a patient, or is that just showing up on scene?
I think, some of those were canceled, some of those calls were canceled en route, we never got there. Actually, the vast majority of them were. And I'd have to go back and look at what the records show to see, what we actually transported last month.
Yeah, so even though, so if you guys do go start responding and turn around, you still count that as,
We just show it as a run because it shows, we were dispatched by Waukesha County Communications. So we show those canceled en routes as an incident.
okay, yeah, because for the month of March, you had more
Yes,
than the whole year so far.
right. And that was a short-term solution. They had an incident where they missed a call, and we ended up transporting that call. And we worked with the medical director for a short-term solution that we were notified that they had a call, and that if, in case they did not respond to the call, we were gonna take it and then do the trip. So that's why we saw a spike in the numbers for that month.
Okay. All right, so we gotta come up with a new contract, because we're missing out on a lot of money and not collecting intercept fees.
That's it.
Raise it to McGuanago's rate.
Well, I have no problem with that, yeah. But at the same point, how do we address making sure that if you show up on scene, we're gonna get some type of reimbursement?
We can put the language in there.
I was asking the chief, see if he's got any,
Well, I think that, again, we've got a couple different pieces of correspondence with our billing company to look at what other agencies are doing. We've been doing some research on our own to see what other agencies are doing. It's all over the board. There's some departments will charge nothing for the no transport. Actually, the majority of them don't charge anything if they don't transport. Some have some language built in for on-scene ALS care, like if we work a cardiac arrest and we don't transport, that there's a fee for that. So those are some of the things that we're trying to establish and figure out what's an acceptable and customary practice, because that's what insurance companies look at when you start sending them fees for services. And a lot of the healthcare insurance companies are now starting to kind of take the philosophy of workers' comp, where they're denying everything. And now we're starting to get a lot of pushback from patients that, hey, I don't have insurance, or my insurance denied this because it wasn't coded properly by the hospital. I've got one guy we're dealing with in the village right now that is, he's got a $2,000 ambulance bill because the way the doctor coded the ER visit, the insurance company said he didn't need an ambulance ride. So now, we're trying to help the guy out, but I mean, he's in a pretty bad pickle, because he's gonna have a $2,000 bill from the village of Vernon and that's one of our residents.
Right.
So, there's a lot of challenges that we're starting to deal with in terms of the billing. Federal government's not a big help. They're not looking to increase their Medicare rates at all. That's where we hit. I think we had 47 or 48% of our patients are Medicare patients. So that right there. I mean, I think last year we billed for $600 and some odd $1,000, and we collected 241. So the system's not set up to succeed because of all the challenges that it has. And unfortunately, when those insurance companies deny paying for an ambulance bill, it falls on the back of our taxpayers. And you know what? You want to deal with some taxpayers that are somewhat frustrated and angry when they get a $2,000 ambulance bill that gets denied by their insurance, and now they have to pay it, and they pay taxes. They're not happy. I get a lot of those phone calls.
So the 240,000 that we collected out of the 600,000 we billed, was that just denied from the insurance company?
Contractual agreements, Medicare write-offs, all those different things that the insurance companies do. And that's the biggest one's the Medicare stuff and Medicaid. We participated in a program called GEMT last year, which is going to realize us, I think, about $40,000 in additional revenue for last year's work that we did. Those payments typically come the second quarter of the following year. It's a brand new program, so we jumped onto that. So that'll hopefully increase a little bit of revenue for us. And obviously we're doing more calls, but that's why we were up in revenue, because we're billing for more calls. But we really like that the intercept thing taken care of. At least like we said, in the interim of getting the 450 established for what we're doing right now. And then our plan was to look at what our neighbors, our closest neighbor is McGuanago, who operates a lot very similar to what we do. And our thought was to initially mirror what they are charging, so that we're not creating a bidding war, so to speak.
Yeah.
And then we can have continuity between the two services, so that there's not try to keep up with the Joneses, so to speak.
Now that 600,000 number was everything, right? That wasn't just like Waukesha or just.
No, that's everything.
Okay,
everything
that's what I
involved. Everywhere we go, everything we bill for.
Yeah.
But again, it's a frustrating. It'd be phenomenal if we could collect 100% of what we bill for, because we'd be in a very good position. But that's just not the way the world works. And then it's very frustrating. It's frustrating to get phone calls from residents saying, "Hey, I got a high deductible, and my first $5,000 is on me, and can you do something to write off this bill?" And I tell everyone there's a hardship, part of our contract that we can that you can try to exercise, but that comes back to you guys, and I don't think too many people take advantage of that. So, and that's something that we're working with Ms. Gunn to look at, the contract that was originally signed by the board with LifeQuest. Because that's probably the point where that should be reviewed as well.
And we can't find the new one.
I can make a comment on it if you would accept it.
Did you get something from them?
So this morning in talking with Cheyenne, there is no contract for
Right.
EMSMC because when EMSMC acquired LifeQuest, they assumed the contract for
Okay.
LifeQuest. There should have been a letter to the village stating that though, that they assume all the terms and conditions of LifeQuest
So I
contract.
could just call Cheyenne and ask for that. Okay, that helps. Thanks, Lynn.
So I guess, here's my thing. No ma, 450, 557, okay? It still has to go to the Village of Waukesha for approval. Their board meeting is the fourth Thursday. That's their next board meeting. So whether we keep it at 450 or we put it at 572, it still has to go through approval. So I would say we match McGuanago right now.
Well, which contract you wanna use? We got 3 of them out here.
Maybe 4.
3 McGonagals?
Well, not the
No,
current
I mean, we
Waukesha
got the one
contract.
current with Big Ben,
Sure.
the old one that we have before, the new one with Waukesha. I mean,
And
which one are we
Waterford.
modifying? And then we should probably get legal review on it then too.
You say we do have a new one with Waukesha.
Well, the one that we signed based on being the same as Big Ben.
Which was the 450.
Yeah, which was a 450.
Okay.
What-
But that was worded differently and not the same as what we previously have with Big Ben.
So it's essentially null and void.
Well,
So we've lost out on over $4,000 so far in the last 2 months here with intercept fees.
so how quickly can we pass this thing? We can't just do the wording tonight, it has to go through legal and all that other stuff, right?
By,
Well, technically.
We can approve it based on legal review.
Right.
And if there is nothing wrong with it, it would be approved. If there is, he would bring it back to us to reapprove with a change.
And is McGonagall's the one that seems to be the most appealing?
there was the number.
Well,
He's
even
just
number
talking about
is
the
better than
interception.
everything
So,
else.
Yeah.
But I don't wanna just approve it with a number and then come back and make changes next month to the.
I
Because
guess,
wording and everything else, right, I agree.
would it be possible to get the 450 thing approved for the Village of Waukesha? Come back within the next, hopefully 30 days with the review of the fees. At that point, send a letter to all of our customers that we do intercepts with to say, we have not had a fee increase in 10 years.
Right.
We are, so we're not blindsiding them
Sure.
and
I think that would be good.
and irritating them.
That's a good
And
idea.
saying that we're gonna reevaluate, we have reevaluated our cost and everyone can agree everything's going up. And we're going to, fall in line with what the customary charges are for surrounding agencies and we know we're comparing ourselves to McGuanago.
Sure.
And then give that to all of our customers and say, you know, we'd like you to, review it and sign the new contract so that we're up to date. And then we should also look at building into that the language of some type of an annual increase
Yes, the
that
Florida
follows the
adjustment.
format of what
Right.
McGuanago follows, so we're kind of on the same page, and
Yeah,
then that way,
3%.
it's not, oh, okay, you know, you're gonna charge us 5% next year versus 10% the year after, it should be some type of,
So fixed,
So,
Yeah.
so I would propose that we go with like the Big Bend contract.
With the
Add-
Wanna-Go number in there and the 3%.
I would, if, what you're saying is just give them a contract to sign and then we'll redo all of them? Is that what you're saying? Okay.
I, I
So what
think we should, because
what-
you're right, we're losing money.
Now, what I would propose is if we're gonna do that, I would think that we would just go with what McGuanago charges right now and send that to them. And then when we change everything, that's fine, but this is gonna be the start. So it has to be approved by us, it has to be approved by the Village of Waukesha, okay? Nothing is there yet. It has to go through legal. So whether we keep it at 450 or change it to McGuanago's 570 or 557, I think.
I'm not sure what their
Five,
exact number is.
550,
something.
552, 557. It's
a weird number.
It's one of those two. Yes, we can go 5 555 in the middle, say 555. It makes no sense to go 450 to go through all that stuff. Why don't we just go with the new rate? I mean, it's gotta go through all this process anyway.
I don't think anyone's disagreeing with you on that.
Oh, I thought you wanted to just pass the 450. Isn't that what you were saying?
That was just a suggestion.
I think he was just throwing numbers out there.
Okay.
Because my thought was that if we will, and this is just my rationale, is if we go with the 450 for the Village of Waukesha right now, with that, they've already approved that, so it's in effect the second you guys approve it. So.
No, it's not. They have to approve it.
No, they already have.
No,
They have.
no, they haven't
have.
They
approved.
sent us a signed copy.
They sent us a
Of
signed
a
copy.
new agreement?
That was their agreement with the 450 in it.
Yes.
Yeah, but that wasn't the same contract as
No.
Big Ben, so
But
it's
if
not.
we approve the contract they send us, it would go into effect tonight.
So you start getting the 450, and then we can.
Well,
review it.
don't think it's a good idea. That would be approving it without legal review.
But we can approve it contingent on legal review.
We could.
Yeah. But we could also,
Just to get it in shape, and then there's the clause in there saying we can notify them that,
See, I
giving
can't-
them 90 days notice of the cancellation of the contract, and then formulate a new one once we've figured everything out. He's just saying, let's get something on paper so we start getting paid.
and then you work the new thing, get it, and then,
That's what I
have
kinda
an
thought we did a month
agreement.
ago, but yeah.
yeah.
I think a new contract with a new.
Is that
with a
accurate?
New fee.
One of those intercept is 557
557.
something.
Okay.
Percent what they charged last year and this year.
It was, what was it, a 3% increase?
And that's on top of what they get, just like us, they get all the money plus they get the 557.
See, if we were to send something to legal review, I'd like to have it finalized where, okay, this is how much is going up each year, and any other changes we wanna change in it, not just,
I did ask the Village of Waukesha for their legal review. Since we have the same law firm, I haven't heard anything from them.
And then if we approve something without legal review, that's going against our board policy, a
Correct.
policy that's in place. So if that's the case, we should just,
so it looks like we're not collecting intercept fees at least for another month.
well, unless they approve it next Friday or Thursday.
Well, we won't get legal review back on our contract to send over that quick.
Well, it should have been done.
Well, it should have been, but I'm not sure if it was.
It should have been.
For that contract, yeah.
Yeah,
I believe they did because, was it Macy's or whoever, Macy's, their attorney, he didn't like a couple ands or ors or something to that effect and made him change, and had a recommendation to change that. It was a format thing. But those are all the same agreements that he's approved over the years.
So what do we do tonight to start collecting the intercept fees? Approving the one?
proving the one Waukesha sent over signed.
We can approve it, and then we can notify that we're.
Upon legal review.
Contingent on legal review, yes.
Okay. It has to be, to go through legal review,
Yes.
correct?
And that should take him 5 minutes to do,
Right, because it's the same thing, right?
yes.
Same people.
So in that case, I'll make a motion to do that,
Right.
to approve that contract contingent on legal review, just to get the collections moving.
Right.
Do I have a second?
I'll second it.
And are you authorizing the village president to sign?
That too. Do you amend your second?
I amend my second.
Sounds good.
Thank you. Now,
All right,
we
you got
can
it all?
work on something
Yeah,
new.
and
And
did you
tell
want,
them we're
did you
bringing
want letter,
new
does the
stuff,
board want letters?
so
by
everybody
month
can be
from all
aware
this?
of it.
Can we do that tonight?
Somebody else talking.
I don't know, are we gonna get it done tonight?
All right, wait a minute,
I think
guys.
We can at least get the ball rolling on it.
Yeah.
Good.
So my other question to the board is, do you want letters sent to these other municipalities that you're considering upping the?
Not yet. Let's get I think we're all in agreement with matching McGuanago. And I would assume the
Right.
3% as well. If there's anything else we want to discuss doing, let's try and do that tonight, and then we can have whoever draft, the new version, and then at the next meeting it can come back and we can either approve or make more changes. And then
Send it.
as soon as that happens, we can give that 90-day notice and then start the new contract. But like I said, with my motion, I think we should at least get something started so that we can start billing for it.
I agree.
Okay.
Well, technically, I shouldn't even sign that contract till after we have legal review.
There's many times where the village president does sign the contract contingent on legal review, and if there is something substantial, if it's a typo, the board's informed of it, but if it's something substantial, even though it's signed, it's brought back to the board.
Then I'm fine with it as my motion was stated.
All right, is there any further discussion on that motion? Hearing none, all in favor of the motion?
Aye.
Opposed? Motion passes unanimously.
On the other topic, is anybody opposed to the, what was it, 557 or something?
555,
557.
Jim?
557.
557.
And some
557.
change.
No, it says 557.
That changed.
And change. Don't forget to change, it adds up.
The chief did, I did put that in your packet. The Village of McGuanago's chief did send you his fee schedule from last year and this year, and it was 557.
And then what, didn't they have an annual
Escalator.
percentage increase or something?
I didn't ask the chief for his agreement.
It was three,
I just
I
asked for
don't,
the money.
I don't think it's annual. I don't know if they,
I can get that for you.
yeah,
Let's
Maybe
get
chief
that,
has it.
yeah.
I
Yeah,
think
let's see what it
last year was 3%. So
Is there an inflation index tied to it or something? Yeah, or, yeah.
I'm not sure. I know I don't know if they implemented it now, but I know that from last year, this year was 3%.
Yeah, I don't know what their mechanism is for, if it's just an annual increase. Because I know when we've offered a contract to another municipality, we've talked about a 4 or 5% increase over the next 10 years or whatever, and people get a little bit worked up about that. But the reality is like
Everything
you said,
costs money.
Everything goes
costs
up.
money.
Man,
It's expensive.
I guess.
My business contracts go up 2.5% every year, automatic renewal.
so is that something you want to add? 3% increase?
2.5, you said, but.
I said 2.5, but yeah, I mean,
Keep it 3.
I'm interested to
Whatever.
see what McGuanago has first, and then we can kind of base it
How
off
they
that.
word their language for, yeah.
That too, yeah.
Okay.
If it's tied to some
I really don't want to rush the new
inflation
version of the
index or
contract
something, you
along
know, or-
just to get something out there. That's what we just did by the last motion, was just to get something going.
Right.
But let's build something that we can use with every single customer we have, and
the other
make it nice and
municipalities.
easy. Yeah.
We can pull the contract from Village of Mugwanago and Waukesha, I think, can't we? It should be in there.
We have to give them 90 days notice, I think, or something.
No, can we can pull, get the contract between Mugwanago and Waukesha and
sure.
read how theirs is worded.
So Mugwanago doesn't have a contract with Village of Waukesha.
Okay, who do they have a contract with? Waterford?
No, I believe
East-
probably maybe Big Bend.
East
Probably
Troy,
Big
maybe.
Bend and East Troy.
Okay,
For the most part, and I think Kettle Moraine.
we might have better luck with East Troy, Kettle
Well, all we can do is, see if they don't vote for it. I mean, then we fall back on the one we just made a motion for that's already approved, but we can always try it.
Well, we can always,
Well, where are they gonna go? Where are they gonna go? So they don't have really many options. It's either us or
Well, you'd be
Mugwanago.
surprised when people come up with it. It may not be the smartest thing in the world, but they'll come up with something just to.
Then at that point, let them.
I wholeheartedly agree.
We do, and if they were to deny that, that would be pretty shameful, seeing as we were in their municipality 38 times last month, and they're most of our mutual aid, so that would really piss me off if they
I don't
denied
think
that.
they would be the ones to do it. I think there'd be some other neighbors that would do it. So,
Which is fine, because who's our biggest supply? It's a Village of Waukesha, right?
call volume probably, I'd say Village of Waukesha.
Okay.
So we're in agreement, we could get the contract, we'll get this thing going through legal review. We're gonna get the contract from McWanago, look at it and see what we like. And then
We'll put together.
we'll
one
put
that-
together what we want, and then we'll send out 90 days notice to all these people and
With the
say,
new- with the
this
new
is,
contract.
yeah, this is our new contract and everything else. And they're more than welcome to come back with the same one if they want, right?
Well, and
We
again,
all could get on it, and that would be nice, but I don't think.
I like the conceptual idea of having the same
Absolutely.
contract for all of our
I
customers.
think that would be
because
best.
Be very
over the years, things have
understandable for
changed a little
everybody.
bit, and
Right.
Where we made the first change was when we dealt with Waterford and we kind of did their precepting when they became an ALS service. We had 3 different levels of billing. It became so problematic because the billing company just wasn't able to function at how we expected it to happen, and that's what led us, like I said earlier, going to LifeQuest. So I just want to have a good contract that makes sense, that's fair.
It's fair to us,
It's
fair to them,
us and to them.
and
Yeah.
seeing as it hasn't been changed in 15 years,
I would hope it would be very little pushback
none at all.
because you got a great deal for the last 10, 15 years.
Right, exactly.
So,
So
And you're not-
we're gonna get the contract from McQuanigo and look at it. We're gonna get this thing approved and through for right now, so we'll start collecting the intercepts.
Or see what the
Based
attorney,
on
see
legal.
what the attorney
Huh?
comments are on this one,
Right.
because I like this one, and we'll just change the numbers, or,
Yeah, we can just
Minor
change, we could
changes
change the
and-
numbers to being the same as McQuanigo, if you don't want the wording to be different. If you like the wording of
Unless they
this
got the
one, let's stay with it and just put the escalator and the money in there,
Yeah.
okay? And then we can just do that pretty simply, right?
Are
So
we
we
I
can
think
send
the
it out
fees
to
should be
everybody
the same
then,
for
and
all
then.
4.
All right, well, let's do something like that as a plan, okay?
real quick?
Instead of just going around and around, let's get the contract, look at it, start this one, all right?
What about charging for when we leave or if we show up? Any thoughts on that?
I think it'd be hard to enforce.
I think so too.
I agree. There's so many variables with incorrect coding by Waukesha County Dispatch, and it's not because they're bad at it, it's because the people that are calling in don't know what they're talking about.
Right.
And some of the calls we get are very mundane, alpha level type calls, which are low priority. We get there and someone's having a heart attack, and sometimes we get called out for that, echo, which is a acute life-threatening emergency, and it's not. So there's so many different challenges that we tend to get dispatched probably more than we probably should be, but that's a whole industry and countywide practice. It is. I mean, Western Lakes goes to Merton in the same kind of project we do here, and it's just part of doing business. And we have a countywide mutual aid agreement that all the municipalities have signed many years ago, that really looks at helping each other out. Because without helping each other out, we really can't do it on our own, no matter what organization you are.
Right.
It's just, people are a commodity today, and it's hard.
Right.
And I think one of the reasons we're one of the more utilized agencies in the county, especially in this area, is that we're reliable. We don't take passes. We have people. We have sufficient people. We had the storms this week, and we had people come in to backstaff, and we handled 12 calls, over a night period with people being up all night. So.
Right.
Those are the things that make us attractive to being a good partner.
You don't go on a paramedic intercept or a mutual aid call unless you can staff the village of Vernon, correct?
Correct.
Okay.
Correct.
So I think we've got a plan going ahead. Let's just go ahead with it for tonight. We've already approved this one, and so let's just go and we'll get the other one, and then next meeting, we'll put it on the agenda, and we'll work it out and see if we come to a conclusion on it and go from there, okay?
I have one more
Very good.
request before we move on,
Sure.
unless you guys want to stay here all night. I would like to see from what's our current place, not LifeQuest, is it LifeQuest?
It's
EMS.
EMSMC.
used to be LifeQuest.
It used to be LifeQuest. Okay, so my understanding, when did we get EMSMC compared to LifeQuest? Like when did we move over?
Well, we didn't move over. They acquired.
They got bought out.
LifeQuest.
Oh, okay, gotcha.
They have acquired like
absorbed
5
us.
different billing companies in our region.
Gotcha. All right. Well, from whenever they got bought out and they would have started tracking any kind of new data, I am interested to see a report of billables that are beyond 180 days,
Don't they get that already?
based on
Don't they get that already? In their report?
broken down by municipality is what I was
I asked
specifically
for that
looking
already.
for.
They get aging reports, but it doesn't give.
You already get that.
Not
Not
by-
broken by
It doesn't say
municipality.
Yeah, it just says
Well, see, I don't know if they can because it's all patient-based. Because when those trip charges are created, it's for the patients.
Yeah.
It would have to be cross-referenced, right?
Right, but like, I mean, the majority of the time it'd probably be fairly accurate, but we get that person that's traveling through Vernon that's a resident of Maguana or a resident of Waukesha or New Berlin that we take in. They get billed as a non-resident, and so that it's not really tracked that way. It's mainly by the patient.
But we should be tracking now from our last,
Well, we have to figure out a way to do it if it's not.
yeah, we did, we talked about this, I don't think you were here. And I was like,
Possibly.
we need to track these calls to the Village of Waukesha, because we're still under that current contract. So we should be, so somebody needs to be doing that, you know? And I thought we couldn't go back, it would be too difficult.
Oh, yeah.
But from that meeting forward, we were gonna track and make sure, and that needs to be done because it's very important. Because it hasn't been done in 4 years.
We haven't been with this company for 4 years.
The contract's been around for 4 years, so
Yeah, but
I'm just saying
trying
it
to
hasn't been
do
done
it-
for 4 years.
Trying to do it with an older data set's going to be really hard if you're going to try and back bill for anything.
Which is fine, I just wanted to see it moving forward from that.
Yeah, and I'm just interested in, you know, the dollar amount and broken down by municipality, and whether it be.
The other challenge that we have there also is that this community has 4 different zip codes.
Yeah.
So it's seven zip codes, I'm sorry, there's 7 different zip codes, so that makes it very problematic as well to try to, and our people do a great job of identifying who a resident and non-resident is.
Yeah.
But to try to break that down to municipality, I think would be like trying to find a lottery ticket that's gonna win.
Yeah.
So what you're saying is we need a post office. No, I'm just kidding.
Yes, we do. We need a zip code.
Yeah, yeah, 'cause I don't think you can actually get through those bills to determine.
No, that makes sense. That's a good point.
Yeah, you don't want something so burdensome that you're chasing stuff all the time either.
Right.
Clean, move ahead. If something falls off, it is. I mean, that's just the way it is, but they're insurance people now,
No, that makes sense.
so. All
Well, we
right,
can't talk about getting a post office because that's not on the agenda, but but it's something I'd be curious
They're all going
about.
broke anyway.
yeah, they're going away.
All right, we have anything more? One on a new contract to consider? We good for now?
We're good. I'm
We're
good.
good.
I'm good.
Did we vote?
We voted on the
Him signing and?
yeah,
Okay.
that one.
I wanna
yeah.
make sure we got the vote.
Yeah, we got that taken
We've been
care of.
talking so much, I got a little
You
lost.
clearly stated what you wanted on the other,
Yeah.
what's gonna come back to you. on the
Right.
other.
No, okay.
All right,
Sounds
Chief,
good.
Chief, you had your report in this packet. I had one question.
Yes, sir.
On those hotspots,
Yes.
where, it's listed on the map, oh, where was it now? I don't recognize the location. Pepper it up on Highway L?
Pepper it up.
Yeah. That's on the map, or, no, it's on the map, so what is this place? Yeah, 'cause
I'd have to look into that. Is it a specific address or
it's
business?
just, it's on Highway L, west on L there. It's like,
Okay.
what is this?
I'm afraid to Google it.
You know, sometimes Google creates some really weird things. Let's see.
Yeah, it's on that map of
I-
hotspots, yeah, pepper it up.
You know what? I think you're reading that wrong. So I know that there's a lady who lives on Overlook Lane, the Tatcheks, very nice family. Used to be my neighbors. She has something on Google. It's like a studio type art thing. I think what you're seeing is that little blue circle there is Overlook Circle off center, and that just happens to line up just above where the heat map is there. We have a resident there that's called us for 5 or 6 transports now.
Okay,
So I think it's just how it happened to
I
fall.
just didn't recognize
Yeah,
that business or anything.
No,
It's like,
I think
what
it's
is this?
it's not even a business. It's one of those things that happens to get clipped to Google because it's
Yeah.
something she does. It's like
Okay.
a thing. So I think that's what that is. It's just like if you look at where it says Vernon Disc Golf, And there's a heat map for a couple calls across the street from here.
Okay.
That just kind of makes it look like that's it, but that's not it.
Okay. Yeah,
So-
I just was confused on that.
Yeah, Pepper It Up has not called
Location.
us.
Yeah, that sounds very.
Could be a shooting range too, if you think about it.
Could be.
So, all right, you have anything else you want to add to your report? We good?
No, I again, if we're looking for, hopefully this is helping you guys with the understanding. We're trying to make it a little bit more
Right.
informative for you. We also don't want to kill you with, worthless data. So if there is stuff you like or you don't like, give us feedback and we'll try to make changes to it.
This is pretty good.
I think
We're
we're
pretty
moving
good
in the right direction.
We're moving in the right direction. We've last year was the first, we transitioned to a different records management system, which was a cost saving, but also is an improvement in the product venture. So we're trying to figure out and learn that system, so to speak, and Captain Stoldorf's been very, very involved in creating some of those reports. So we're trying to kind of fine tune that a little bit.
All right, thanks for coming tonight, Chief.
Thanks, Chief.
So I was at the house, just so you guys know, we're gonna be burning a house on Saturday, on 164 for training. So if you
Okay.
guys aren't around, wanna come watch, you're more than welcome to
Is that
stop
over
on by.
the paintball?
It's just to the north there, it's the Proventure. Nice house. So,
And he doesn't qualify for ADU, so it's gotta go.
well, it's gonna go.
Burn, baby, burn.
All right, you guys don't mind if we deviate the sheriff's here?
No.
You have anything you'd like
No.
to add to the report?
I have nothing, sir.
Okay.
I'm just
Anybody
glad we went before the sheriff this time. Thank you.
have Anything for him?
No, I don't think so. I live a mundane life.
Thank you. All right, back up to bid notice for door on salt shed.
I see we've got Consolidated Doors. Are they the only ones that quoted?
Yes, and we called other door companies and no one is interested. Geis, we called several, I
Yeah,
shouldn't say
really?
that, Brett did. None of them were interested.
Not even like Joe
Like-
Wildy or whatever.
Well-
Lifetime, none of them?
If any board member wants to call and see if you can get somebody out here, but he said he called 3 different big, the big, and no one.
Is there,
Well,
is
we're
there,
just issuing a bid notice right now,
That was
right?
done already.
Oh, okay,
The bid notice was done.
gotcha.
so is there one that Brett likes?
The consolidated,
Well, I know that, but I mean, is there a door? There's 3 different doors there.
the
isn't
most
there?
expensive one, it's erosion, it doesn't have any, it's all galvanized, it's not gonna rust, it's
Yeah, the
the
difference from
best
the
warranty.
medium one
Yeah,
and this one was
Yeah.
the size of the stainless steel tracking. It went from 2 to 3 inch,
okay.
but everything else was the same on the 2 bids. It was
Oh, I
just
see,
that-
2 to 3 inch, yep.
Yeah, that was the only difference I saw.
Okay,
And for the few dollars more, I think we're better off getting a heavier duty tracking because that salt's hard on.
Yeah.
Get
Stuff.
one that lasts.
do we have money for this right now?
Do we ever?
Sometime. You can make it.
Well, I should say you did budget $30,000 for the new generator, and we're only gonna spend 9, so you'd have the 20-some thousand
There
there.
we go. All right.
Love it when a
So
plan
we'll
comes
create more
together.
work for you to change the old budget around.
No, it's not a problem. I do a resolution so that anybody coming forward could see that, instead of the 30, it's just a clear track of.
Yeah.
I will make a motion to approve the polycarbonate door and stainless steel track for the salt shed
I'll second that one.
From Consolidated Doors
from
Incorporated.
Consolidated Doors, yes.
At almost $20,000.
Yeah, once you take the 573 off it, yep.
All right, motion was made and seconded. Any further discussion? Hearing none, all in favor of the motion? Opposed, motion passes unanimously. Legal review of the Village of Vernon board issues. There was a list of the,
Jeff,
What-
were you on the board when we did this?
yeah,
I don't know where this board stands, but it's kinda nice to have a clear policy on what you guys all agreed to do. I should tell you zoning, ordinances are always sent to the attorney because that's gonna be Vernon law.
Sure.
But I just wanted you to see the progression of what the village board started with and then how it changed and whatever you guys would like to do.
So legal does review all village board agendas and minutes?
They don't do that anymore.
Okay, so this is legal required, it says, by the village.
Yeah, they don't. If Ramsey does, he doesn't charge for it.
Okay, but, all right.
We stopped all review of agenda and minutes.
Well, it just says legal services required by the village.
Yeah,
And that's got a little confusing to me. It sounds like we're supposed to be sending it through legal review all the time, all these things, and we haven't been doing it, so.
yeah, some of those things should be listed differently.
We could call it legal services available to the village. You know, we either use it, you know, if we got something sticky, we can use it, otherwise, but you can call it available, not required.
I think the
What
main thing,
page are you on?
there's notices for public hearings.
18 of the PDF.
No.
Do we do that anymore?
No, you had a clerk that sent, poor Michael Alex spent hundreds of dollars on,
Right.
public notices should not be unless, if I didn't
Yeah,
understand.
it
If
says it
something's
needed.
tricky, I would call the attorney, but a legal notice is a legal notice. That's my opinion, but if you want me to send them to the village attorney, I will.
All right, so that one's, no, less we need a village attorney, the better.
I think what we've been doing right now seems to be working, right?
Yeah, we're down quite a bit on legal costs over the last,
And,
especially the last year.
and I don't think we've had a lot of problems with anything legal right now, have we?
Oh, we're always getting into trouble.
DA hasn't gotten after us
I'd
for
say just
anything.
keep
No, I know.
I'd say just keep it the same way we've been doing.
Yeah,
Yeah, I tend to
and if
agree, I
anything
think.
comes up where we think we need legal review, we can,
Then we can
You
send it
know,
through.
Let's
like
not
use
fix
them,
something
like
that's
use them
broken.
only if as necessary.
Let's not
'Cause
fix
that can
something that's
save
not
on
broken, you
Legal
know?
costs.
all right, we'll keep that the same. Allowing candidates to introduce themselves to the village of Vernon.
Oh, that's Jim?
Yeah, I was just wondering what you guys thought about having like the two sheriffs that are running for office, if they were to come and speak in front of the board. Right now, I think we have what do we have, an ordinance or a?
We
I
have a
couldn't find
policy.
anything. I couldn't find, I should have checked the policies. Yeah, there was something where, because I know,
Carl Fortner used to announce it, right?
Yeah,
You know,
that-
before everything.
boy, if anybody was running for office and came into Vernon, man.
No,
Let me
I just
check.
wanted to
He
get you
shut
guys.
that down real
It's not-
quick.
He did.
I mean, with like, I don't know if you want to put, they can come and introduce, the sheriffs. They're both running. I don't
I'd be
know.
open to letting each of them put a
Well,
thing in the newsletter.
The problem, or on our website,
Sure.
questions and answers type thing or something.
Yeah,
or-
we could do something
or
like that,
info or bio or something. Problem is, we start letting them come speak, where does it stop? Obviously, you get all the school board members running it, I mean, it just,
We could put a time limit on it, if you wanted to.
Well, the questions should all be the same,
Right.
whoever you're asking,
Right.
and the limitations are the same for whatever
Right,
candidate.
right. Just, give a brief,
or just leave it at them, 100 words about yourself or something, how short can we? And put it on our
yeah.
Facebook page.
I like listening to people, that's just me,
Sounds like an idealistic, nice thing, but, I'm not quite sure it's that
I mean-
necessary, though.
So I guess what the thing was for me was the sheriff,
Well, that's
The-
it,
it's
but
the sheriffs are, I know it's everybody,
if
I
you're
know
gonna
it's
do
everybody.
sheriff, you're gonna have school board.
I know,
and
I
you
know,
open
I
it
know.
up.
They could,
You open it up.
they could talk your ear off for an hour.
Yeah,
Yeah.
you could be here a long time.
But I should tell the board, there was several compliments on the fact that we had something on our website about local candidates. A lot of people, the Freeman does, and so does the Journal, Waukesha
Sure.
Journal, but
Yep.
who gets those
If you don't
papers?
subscribe to it, you don't
Yeah.
see it.
Right.
You know.
Nobody.
So, I mean,
yeah.
that's where we would put it, if the board agrees, we'd put it on our website, so at least people know, geez, if I wanna look at the school board race or the sheriff's race.
Sure.
That's not difficult to do.
Yeah, I think that's a good idea. I think we just stick with doing something like that
Yeah.
rather than trying to.
A accommodate everybody to come in and speak.
Right.
Yeah.
All right, so we need a motion to allow candidate info Facebook page, or our website.
Probably mirror the
Just like a
policy that
questionnaire or
we have
something.
for our local candidates too, and I'll bring the policy back at the next board meeting that we do for local candidates, and then if you agree to that, then we'll make a little resolution. Is that okay with the board members?
Works
Yes.
for me.
Sounds good.
Yes.
Okay,
All right, and the Village of Vernon Summer Newsletter.
started working on that, but wanted to know, is there any board members that wanted to write an article?
I got nothing interesting to say.
Well, if you do have something, please get it to me as soon as
Okay.
possible. Sound
Sounds
good?
Yep.
All right, moving on to correspondence.
When do you have to have that by the way?
If you get it to me end of the month,
Okay, just so everybody knows.
Correspondence and announcements. I just want to announce that a few weeks ago, I did meet with Village of Waukesha's president Chad and their DPW. Brett and I went over and talked,
Yeah.
trying to figure out a way, if there's a way to save combining DPWs. Going through it, I just saw expenses going up for us. I couldn't see where it would be a savings. A lot of issues with different, you know, they only plow half the roads. They have 2 trucks. And they
Sub out the rest.
sub out the rest.
Subcontracted out.
You know, so it's kind of, and we do more work, ditches and everything than they
Right.
do. And I just see us being over there more, doing stuff, and at the same point, you need a DPW, a director to oversee all this. So if that's taken away Brett from working here, cause he's over there, we're gonna need another foreman here. Then the mechanic is gonna be running around, he's not available to help here on the crew. You know, I just see expenses versus savings.
It's a little bit like the fire department, actually, between the two places.
So, you know, I'm open to the idea, but I just can't see where it's gonna save us money.
Right.
I
So
think
that
just
was,
leave it the way it is.
Enough said for me, yeah.
so
Let's
that
leave
was,
it.
yeah,
It's gonna
my
help our-
discussion with them, and that is all I have. Trustee Pecca.
Well, I just want to say, thanks, spring. Best wishes to everybody getting their yards in shape after a long winter. That's all.
I
Gary,
don't have anything tonight.
Dylan,
Nothing really.
Jim.
You're right, Chair Board.
All right, we had the March Treasurers Bank reconciliation in the packet. We just have to acknowledge, or you need a motion to approve? I always forget.
no, it's just for review. We don't
Okay.
need a formal motion on that, nope.
And then there was also the Town of McQuanigo Vernon 2025 recreational report.
That was impressive.
Yeah, it was.
Didn't you think
Yeah.
the report that Dave did was excellent? We get
Yeah, I
so
thought
many.
so, yeah.
So I just want the board to know, so many compliments from residents that, on what you decided to do, the collaboration with the town of Guanaco, they're so happy, just so you know.
That's good. Yeah,
Good
that's great.
decision, guys.
I was surprised to see the number of seniors or adults that took place in a lot of activities too, because you think of just being little kids, you don't think of adult programs at all.
Right, yeah.
All right, Karen, Village Administrator, Clerk Report.
First of all, congratulations to trustee Jay Pekka and trustee Dylan Newman on your
Mine was real hard.
on your election. Just wanted to thank you for your service. Being an elected official is a fun job, isn't it, guys? Right, guys?
Oh, yeah.
I
Rainbows
wanted
and
to send out
sunshine.
a very big thank you to the Vernon Fire Department. I have to tell you, the night of the storm, I was on the phone with County Dispatch quite often, and we had a lot of trees down, trees in the road, emergencies in our fire department. I don't know if all fire departments do this, but those guys and gals were right on the scene, cutting trees down, moving trees, putting up barriers. I just wanted to send out a big thank you. Our DPW department came in at 7 in the morning, normal time, and they were working really hard all day long to pick up brush. And if anybody does have trees or brush, we have the DPW yard open. Tuesday or Wednesday night, I stayed late and 5 people, I put on Facebook and our website, if somebody couldn't get here by 3:30, I'd meet them later, and we had 5 people bring just truckloads of dead trees, and because they couldn't make the But, just wanted to thank them for that. And also the Emergency Government Coordinator for Waukesha County, outstanding job. That guy, it's the best investment Waukesha County, one of the best investments. He started a page now, so I can report on the county site any expense the village has paid towards this storm. And it goes into a collaborative spreadsheet that reports to the state for requests for funding, which I think is great. And he also supplies a tremendous amount of information, one of which you had in your packet about storm chasers and stuff. Does a great job. Also, the board, I hope you don't mind that I'm sending you all the reports I'm getting from the DOT on all the road projects, just to keep you informed. And unfortunately, our Edgewood Avenue project didn't make the cut. We are not getting the funding.
Yeah, I saw that. That's too bad.
I don't know if the city, it was the city of Oconomowoc and the village of Vernon that, I don't know if the city got it, but we did not get that grant. So, Brett's gonna be working on the alternative that the board agreed upon if we wouldn't get Edgewood Avenue, and he'll bring you that information, just so you know that we didn't get it, but he's working. I did submit the MS4 permit to the DNR, but there's an issue because most municipalities do an annual report and we do a biannual report. So it's submitted, but their technical people we're having trouble getting it to the DNR because we're the only municipality in the state of Wisconsin that does it biannually. Just so you know, as soon as it's complete, you guys will get a report.
Should we change that sometime?
Oh, no, you don't wanna change it because then you gotta
We don't
pay,
wanna do it annually.
then you gotta pay
You don't wanna do it
then you
annually?
pay $6,000 every year. Well, so now we pay $6,000 every other year, so you don't.
Oh, okay,
You
never
don't
mind.
Do it every
Never
decade,
mind.
it's fine.
And then, let's see, I think one of our plan commissioners and his daughter is attending, who spoke at many of the public hearings. He's attending the Big Bend Plan Commission meeting about the Breck Sports Complex. So hopefully he will give us some information on that. I just wanted to give you briefly on the April 7th election. Out of the 5,699 registered voters, 2,045 voters did vote, so we had 44.5% of the registered voters come in. I did mail out 900, I'm trying to scoot down here, 980 absentee ballots, and of that, 584 were not returned, which cost the village of Vernon $1,401.65, which there's nothing we can do. I am, just so you know, I am lobbying our legislative officials so that we could put some type of a postmark if it's not returned. We'll pay for it if it's returned, like a business does.
Sure, yeah.
But to spend all that money, to send it out, I can't do anything about it. That's the law. But it's silly to have that return postage, that we pay for, that they don't even return the ballot. And I did put when I stuffed the ballots this time, I think I have about 50 residents that are requesting not to have return postage because they prefer to bring it in. So the more and more residents that drop them off at the village, it saves the village money. And we had a total of 825 absentee voters, 429 came in the clerk's office to vote, and the rest of them were absentee by mail. And that's my report, thank you very much.
All right, in the packet, we also had the Citizens Bank investment portfolio.
Yeah, no motion on that, it's just presented to the board so that the auditor sees that you're seeing where all the securities lay as it relates to our millions of dollars, especially during tax time.
All right, then we have the EMS-MC March report.
I could not get anything from that company, so bear with me.
Trying to get it,
And
huh?
legislative updates, I saw one email.
Oh, yeah, and then I hope you read the one, we're working on our master plan. I hope you read the email from the attorney on the change in the state law as it relates to zoning and planning. I'll put that in your packet, next time, just in case you missed it, but.
All right, now we have accounts payable for April 16th, batch number 202-60416, the amount of $84,937.91.
I'll make the motion to approve batch 20260416.
Is there a second?
I'll second.
Any discussion? Hearing none, all in favor of the motion?
Aye.
Opposed, motion passes unanimously. Then we have a correction from the last, accounts payable from 4/2/2026. It's now, the correct amount is $121,678.71.
I'll make the motion for the correction, for the reimbursement check for 4/2/2026 for $121,678.71.
Second.
Any further discussion? All in favor of the motion?
Aye.
Opposed, motion passed unanimously. We had the March financial statement update and audit update.
I think the auditor has almost everything she needs for the audit. She did email to me that she's working on deadlines for other municipalities that pay to have it done before ours, so we're in good shape there, gentlemen.
Okay, and then we have minutes, March 11th. Were they in the packet?
It should have been.
Oh,
That
sure.
was the finance meeting,
Oh.
finance and village board. That finance committee
That's
just,
right, okay,
yeah.
Is there a motion to approve the minutes from March 11th? That's the Village Board and Finance Committee meeting.
I'll make that motion.
Is there a second?
I'll second.
All in favor of the motion?
Aye.
Opposed, motion passed unanimously. Then the minutes from April 2nd, where I was not there.
That was the quickest board meeting we've ever had record.
What can I say? I'm efficient. No, I'm just kidding.
That's right.
11 minutes.
Yeah, I came in and sat down, they go, "Oh, we're going, go here."
You guys will be to miss more often, knowing
Then we get out quick.
I'll make a motion to approve the April 2nd, 2026 Village Board minutes.
I'll second.
Motion is made in second. Any discussion? Hearing none, all in favor of the motion?
Aye.
And I'll abstain. Motion passes. Announcements, March 7th and 21st, March 7th and 21st, Village Board meetings. May 13th, Village Board and Plan Commission meeting, and May 18th is the Board Review from 6 to 8 p.m. Moving into closed session, which I read earlier. You go by roll call
No,
vote.
first you need a motion before you can.
Oh, I guess that does help. Is there a motion to go
I'll
into
make that
closed
motion.
session?
I'll second.
President Jeff Millies,
Aye.
Trustee Jay Pecca,
Aye.
Trustee Gary Finch,
Aye.
Trustee Dylan Newman.
Aye.
Trustee Jim Hurd.
Aye.
Mr. President, note for the record that the village board has moved to go into closed session by unanimous roll call vote at 7:27 PM.
Thank you.
Have a good night.
Hey Karen, just so you know, I'm not gonna be there on the 7th.
Oh, you're out of town?